David Newell, Head of Healthcare, Gemserv.
David, what do you think of this report? Have you managed to read all 92 pages of it?
I haven't read all 92 pages. I've read the first 60, and then I've spent the afternoon here and actually really understanding some of the meaning behind the words, which was great.
What most excites you?
I think there's a common vision. The reality is there's a real sense of common direction. For me now, the challenge is making it happen.
And what do you think are the biggest challenges within that goal to make it all happen?
I think there's two. What we're looking at here is taking a whole system and changing the way that multiple components work together. That's a big enough challenge in its own right. And the other end of the spectrum is about engaging people and places, as we've heard, and making people take ownership of their own health, longevity and wellness. Those two that's difficult, but I think we can do it.
We've got a number of core recommendations, but the overarching one is to meet the government's goal of adding those 5 years of healthy life expectancy for all of us, rich and poor, by 2035. Now that's the long-term goal, which seems to many to be far too short of a runway to achieve all of that. But let's look at 5 years out. What would you like to see that's really moved the needle on this?
I'd like to see a focus away from treatment to public health, a focus on really understanding how you build into the system a divergence from the NHS of the last 72 years. I'd also like to see data shared. I think there were some really, really solid comments about we have to have trust to share data, and data is the basis of where we're going to move forward. So those would be my two big things I'd look for.
And will your participation as a sponsor of the APPG for Longevity refine your approach?
Yes, it will. And actually the one thing that I've come away from today is with a renewed vigour to continue to support this. It's too important for us not to take part over the coming years.
Thanks so much, David Newell of Gemserv Health. Thank you.